My name is Lindsay Parks. I'll be presenting the first two questions. We'll start with the first one. What's the primary activities performed by the prison nurse, also known as a correctional nurse? We have intake screening of physical and mental health. They also screen for infectious diseases such as tuberculosis, HIV, STDs. Prisons are often overcrowded, so communicable diseases are spread very quickly. Nurses also help coordinate outside services such as surgery and hospital stays. If the prisoner needs to be sent to a hospital because they require higher level of medical attention, then they send them to a specific hospital with strict surveillance. The correctional nurse also helps to arrange continued care and medications for when an inmate is discharged or released. Inmates may have a hard time adjusting to the outside, and medical needs are not always their top priorities, so doing this for them kind of gets a little bit off of their plate. They also administer vaccinations such as flu, pneumonia, hepatitis A and B, and then Tdap. And the scope of correctional nursing includes health assessment, nursing diagnosis, addressing acute care needs like wound care, administering medications as prescribed, and providing health education. This specialty practice deals with quite a unique population demographic. There are often environmental constraints and ethical dilemmas. I've heard that wardens are threatening the nursing staff if they don't medicate a patient, that they will charge them with insubordination, and these patients don't have any orders for these medications. So these nurses need to stand up for what's right, and they need to stand up for their nursing license. The second question is about teaching and learning strategies for this specific population. The most important role is keeping strict boundaries with inmates. No therapeutic touching, no consoling, no hugging, nothing like we do in the hospital sometimes. No personal stories. They don't want you to release any personal information to inmates. Also, knowing which requests are appropriate. Inmates tend to request more and more. If you grant them one wish, they keep asking, and they kind of take advantage of their healthcare provider. As in all healthcare settings, it is important to be culturally aware. Prisoners had a very diverse population, and their culture may affect their treatment. Some prefer holistic remedies or herbal remedies, and they refuse medication, so it makes it very difficult in this kind of care setting without these options. A prison nurse must use their time wisely. Prisoners are often on a strict schedule, so teaching and answering questions needs to be straight to the point because everything's kind of rushed. That communication is just very straight to the point. It's the most necessary way of getting it across. And last but not least, acknowledging or greeting inmates when possible is recommended because it gives them a sense of respect. So if they feel like you respect them, they'll tend to respect you, and it makes your job much easier when you guys come down to trying to treat them.